A new bill in Oregon could allow patients who suffer from dementia or mental illness to be starved or dehydrated. The legislation would create a committee to make changes to guidelines governing end-of-life decisions. Oregon Right to Life says current laws protect patients from this type of cruelty. The group says this bill would take away those safeguards. There's much more on that bill online right now. Visit our partners at CatholicNewsAgency.com to read more about it. If Congress doesn't intervene and reverse Washington, D.C.'s assisted suicide law, then it will join California, Colorado, Oregon, Vermont, Washington, and Montana in legalizing some form of assisted suicide. Joining us now is Genevieve Plaster, Senior Policy Analyst for the Charlotte Lozier Institute. Welcome to the program.
Thank you, Lauren.
So that means it would be the 7th jurisdiction. Then there are 20 others considering legislation. What is your group doing?
That's right. The Charlotte Lozier Institute is a research organization, and we are looking to provide the best data on this and examine all of the reports from states that have had this experience over the years, and just empower the general public and our legislators to know this is a dangerous policy.
So you told me earlier when we were sitting off of the set that that the Oregon law began in 1997, and that you've gone back and looked at all of those annual reports from Oregon. Tell us how many people have died under this law.
In Oregon, since 1997, there have been about 1,000 people who have successfully requested and died under this physician-assisted suicide law.
In the last 5 years, also in Oregon, an average of only 2% of patients who died were referred for mental health. Why is that troubling to your organization?
Well, it's incredibly troubling. Obviously, we are a pro-life research group, and we value all human life, no matter the stage, no matter the age or capability. And for people who have mental illnesses or are depressed and have terminal illnesses, not to be given an opportunity to have counseling prior to requesting these lethal drugs is extremely troubling.
And they might not, I think, they might not have ended their lives, is
Exactly.
the point. Is that right?
Yes.
Advocates for the elderly and the poor, advocates for people with disabilities say these groups are really vulnerable, especially vulnerable to being pressured to an early death. Do any of these laws have safeguards to prevent coercion?
The supposed safeguards that are in these bills, again, Oregon was the first to pass legal assisted suicide, and so it is a model for all of the states that have assisted suicide and is the model for DCs. And the supposed safeguards do not protect those who have mental illnesses, those who have disabilities. The way that the terminal diagnosis is defined in these laws allows for, it's very vague, and it allows for those who may, within 6 months or less
be dying, and then people can say, well, you could die now. That's sort of the coercion piece of it, and that's not really addressed.
Right.
Right, right. Okay, thank you so much for your time, Genevieve Plaster, Senior Policy Analyst for the Charlotte Lozier Institute.
Thank you.